I'm a doctor. I've helped hundreds of women with breastfeeding, and when it was my turn, I still struggled. My nipples cracked and bled. I got mastitis twice. I cried because it hurt so much. And I almost gave up multiple times. But I also learned exactly what works and what doesn't. Today, I'm sharing everything about breastfeeding that I wish someone had told me before I started. The real problems, the real solutions, and the truth that nobody wants to admit. Breastfeeding is hard. Hey everyone, I'm Diana and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health and I'm a mom of 3 who breastfed all 3 of my babies. But here's what I want you to know. Breastfeeding did not come naturally to me. Despite all my medical training, despite helping other women through it, when it was my turn, I struggled. And I think that's important to say because there's this narrative that breastfeeding is supposed to be natural and easy and beautiful from day one. For some women, it is. But for most of us, it's a learning process. It's challenging. And it takes time to figure out. So today, I'm breaking down the most common breastfeeding problems and giving you real practical solutions. Not vague advice like just relax or trust your body. Actual techniques that work. Let's start from the beginning. Let's talk about what breastfeeding is actually like in those first few days after birth. Right after delivery, you'll be encouraged to put the baby to your breast for skin-to-skin contact. Some babies latch right away, some don't. Both are normal. What you're producing in the first few days is colostrum. Colostrum is this thick, yellowish fluid that's incredibly nutrient-dense and packed with antibodies. It's sometimes called liquid gold because it's so good for your baby. But here's what surprises new moms. You only produce tiny amounts. We're talking teaspoons, not ounces, and your baby's stomach is the size of a marble on day 1. So those tiny amounts are exactly what they need. But it doesn't feel like enough. I remember looking at the tiny drops of colostrum and thinking, there's no way this is feeding my baby. I was convinced she was starving. She wasn't. Babies are designed to get exactly what they need from colostrum in those first few days. What you might experience, your baby will want to nurse frequently. We're talking every hour or 2, sometimes more. This is called cluster feeding, and it's completely normal. Your baby is not just eating. They're also stimulating your breasts to start producing milk. The more they nurse, the faster your milk comes in. Your nipples will likely feel sore. Not excruciating, but tender. Like they're being stretched and pulled in ways they've never been before. Because they are. Around day 3 or 4, your milk will come in. You'll wake up one morning and your breasts will be hard, full, and possibly painful. This is called engorgement, and we'll talk more about it in a minute. But first, let's address the #1 issue that almost every new mom faces, getting the baby to latch correctly. Breastfeeding hurts beyond that initial tenderness. The problem is almost always the latch. A proper latch means the baby has a big mouthful of breast tissue, not just the nipple. Their lips should be flanged out like a fish, and you should see more of the bottom of your areola than the top. Signs of a good latch. You feel a strong pulling sensation, but not sharp pain. You can hear the baby swallowing regularly. The baby's cheeks are full and rounded, not sucked in. When the baby comes off the breast, your nipple looks the same shape it went in, just wetter, not flattened or pinched. Signs of a bad latch. Sharp. Shooting pain during nursing. Your nipple comes out looking flattened, creased, or lipstick-shaped. The baby is making clicking sounds while nursing. Your nipples are cracking, bleeding, or developing blisters. If the latch is wrong, don't just suffer through it. Break the suction by sliding your finger into the corner of the baby's mouth, take them off, and try again. I had to do this 10 times in a row, sometimes with my first baby. It was frustrating. But once we got the right latch, the difference was immediate. Here's how to get a good latch. Hold your breast like a sandwich with your thumb on top and fingers underneath. Wait for the baby to open their mouth wide. Tickle their lips with your nipple if you need to. When their mouth is wide open, bring them to your breast quickly. Don't lean your breast into their mouth. Bring the baby to you. Aim your nipple toward the roof of their mouth. You want their chin pressed into your breast and their nose free to breathe. If you're still struggling after trying this, ask for help. A lactation consultant can watch you nurse and correct your positioning. I saw one with my first baby, and it made all the difference. Don't wait until your nipples are destroyed. Get help early. Let's talk about nipple pain, because this is what makes so many women give up breastfeeding. Some tenderness in the first week is normal. Your nipples are adjusting to being used in this way. But if you're in severe pain, if your nipples are cracking or bleeding, something needs to change. The most common cause? Bad latch. Fix the latch first. Everything else is secondary. But even with a good latch, your nipples might still be sore in the beginning. Here's what helps. First, medical-grade lanolin. Apply it after every feeding. It creates a moisture barrier that helps your nipples heal faster. It's safe for the baby, so you don't need to wipe it off before the next feeding. Don't use the cheap lanolin from the drugstore. Get the good stuff. It's $30, but it's worth every penny. I went through an entire tube in the first 2 weeks with my first baby. Second, hydrogel pads. These are cooling gel pads that you stick inside your bra between feedings. They soothe sore nipples and promote healing. I kept mine in the fridge, and the cool sensation was incredibly relieving. Third, Silverette cups. These are small silver cups that you wear over your nipples between feedings. Silver has natural antibacterial properties and creates an ideal healing environment. They're expensive, around $60, but they work. I used them with my second and third babies, and my nipples healed much faster. Fourth, air them out. I know this sounds weird, but letting your nipples air dry after feeding helps. Don't immediately put your bra back on. Let them breathe for a few minutes. I walked around topless in my bedroom more than I'd like to admit. What if your nipples are already cracked or bleeding? Keep nursing if you can. I know it hurts, but stopping can make engorgement worse and tank your milk supply. If it's unbearable, you can pump on the injured side and nurse on the other side until it heals a bit. And definitely see a lactation consultant. There might be an underlying issue, like a tongue tie or lip tie, that needs to be addressed. When your milk comes in, your breast can become painfully full and hard. This is engorgement. It usually happens around day 3 or 4 postpartum, and it can be shocking. You wake up with breasts that feel like rocks. Why does this happen? Your body doesn't know yet how much milk your baby needs, so it overproduces at first. Plus, there's increased blood flow and swelling in your breasts. What helps? Nurse frequently. The best way to relieve engorgement is to empty your breasts. Feed your baby on demand, even if that's every hour. Use cold compresses between feedings. Frozen peas in a bag, cold cabbage leaves, or ice packs wrapped in a towel. The cold reduces swelling. I used cabbage leaves with my first baby. It sounds crazy, but it works. The shape of the leaves conforms to your breast, and the cold is soothing. Use heat right before feeding. A warm shower or warm compress helps your milk let down so the baby can drain your breast more effectively. Hand express or pump a little if needed. If your breasts are so full that the baby can't latch, express just enough to soften the areola so the baby can get a good latch. Don't pump too much or your body will think it needs to produce even more milk. Engorgement usually resolves within a few days as your body figures out how much milk to produce. If it doesn't improve, or if you develop a fever, call your doctor. It could be mastitis. One of the biggest fears new moms have is that they're not producing enough milk. But here's the truth. Most women who think they have low supply actually don't. They have perceived low supply. How do you know if your baby is getting enough milk? Count wet diapers. Your baby should have at least 6 to 8 wet diapers in 24 hours after the first week. Count dirty diapers. At least 3 to 4 poopy diapers per day in the first month. Monitor weight gain. Your baby should regain their birth weight by 2 weeks and then gain about an ounce per day. Watch the baby during feeding. You should see strong, rhythmic sucking and swallowing. If those things are happening, your supply is fine. It doesn't matter if your breasts feel soft. It doesn't matter if you can't pump much. What matters is whether your baby is growing. But what if you genuinely do have low supply? First, figure out why. Common causes include not nursing frequently enough. Supply is based on demand. The more you nurse, the more you produce. Poor latch. If the baby isn't effectively draining your breasts, your body won't get the signal to make more milk. certain medications, hormonal issues, or previous breast surgery. How to increase supply. Nurse more often. Aim for at least 8 to 12 times in 24 hours. Power pump. After nursing, pump for 10 minutes. Rest 10 minutes, pump 10 minutes, rest 10 minutes, pump 10 minutes. Do this once a day. It tricks your body into thinking you're feeding twins. Stay hydrated and well-fed. You need extra calories and fluids to make milk. This is not the time to diet. Consider Galactagogues. These are foods or supplements that may increase supply. Oatmeal, fenugreek, blessed thistle, brewer's yeast. I ate oatmeal every single morning. Did it help? I'm not sure, but I figured it couldn't hurt. Rest as much as possible. Stress and exhaustion can tank your supply. If you've tried everything and your supply is still low, supplementing with formula is okay. Your baby needs to be fed. A fed baby is the goal. There's no shame in using formula if you need to. I supplemented with my third baby because I went back to work and couldn't pump enough. She's perfectly healthy. Mastitis is a breast infection, and it is miserable. I got it twice with my first baby, and it was one of the worst experiences of early motherhood. What is mastitis? It's when a milk duct gets clogged and bacteria gets in, causing an infection. It can happen suddenly, and it needs to be treated immediately. Symptoms: a hard, painful lump in your breast, redness and warmth in that area, flu-like symptoms, fever, chills, body aches. You feel absolutely awful, like you've been hit by a truck. What causes it? Not fully emptying your breast during feeding, going too long between feedings, a blocked duct that doesn't clear, cracked nipples that allow bacteria in. What you should do if you think you have mastitis: call your doctor immediately. You need antibiotics. Don't try to tough it out. Keep nursing. I know it sounds counterintuitive, but nursing helps clear the infection. The baby won't get sick from it. Nurse on the affected side first when the baby's suck is strongest. This helps drain the clogged duct. Apply heat before nursing to help the milk flow. Massage the lump gently while nursing, pushing toward the nipple. Rest. Mastitis is your body's way of telling you to slow down. Take it seriously. With my first bout of mastitis, I ignored it for a day, thinking it was just a clogged duct. By the time I called my doctor, I had a fever of 102 and could barely move. Don't make my mistake. If you suspect mastitis, get help right away. How to prevent it? Nurse frequently and fully drain your breasts. Don't skip feedings or go long stretches without nursing or pumping. Treat clogged ducts immediately by nursing, massage, and heat. Wear a properly fitting bra that doesn't constrict. Some women have the opposite problem. They produce too much milk. This sounds like a good problem, but it can actually be really challenging. Signs of oversupply: your baby chokes, sputters, or pulls off the breast frequently during feeding. Your baby is gassy and fussy because they're getting too much foremilk, the watery milk, and not enough hind milk, the fatty milk. Your breasts are constantly engorged and leaking. You're soaking through breast pads multiple times a day. What causes oversupply? Sometimes your body just produces more than your baby needs. Sometimes it's because you've been pumping too much in addition to nursing. What helps? Block feeding. Nurse on one breast for a set period of time, like 2 to 3 hours, before switching to the other side. This signals your body to slow down production on each side. Nurse in a reclined position. Leaning back lets gravity work against the flow, which can help your baby manage the fast letdown. Let your baby pull off when the letdown is too strong. Catch the spray in a towel, and then let them latch back on once the flow slows. Don't pump unless absolutely necessary. Pumping signals your body to make more milk. Oversupply usually regulates itself within a few weeks as your body adjusts to your baby's needs. If it doesn't, or if it's causing significant problems, talk to a lactation consultant. Before I finish, I need to say something important. If breastfeeding doesn't work out, that doesn't make you a failure. There's so much pressure on new moms to breastfeed exclusively. And yes, breast milk has benefits. I'm not denying that. But you know what else matters? Your mental health, your physical health, your ability to bond with your baby. If breastfeeding is causing you extreme pain, anxiety, or depression, it's okay to stop. If you need to supplement with formula, that's okay. If you choose to exclusively formula feed, that's okay too. A fed baby is a healthy baby. A happy, healthy mom is what your baby needs most. I supplemented with all 3 of my kids at different points, and they're all thriving. Please don't let anyone make you feel guilty about how you feed your baby. So let's recap the main points. Breastfeeding is a learned skill. It takes practice for both you and your baby. Get the latch right. If it hurts, something is wrong. Get help from a lactation consultant. Sore nipples are common in the first week. Use lanolin, hydrogel pads, and air them out. Engorgement happens when your milk comes in. Nurse frequently and use cold compresses. Most women have enough milk. If your baby is gaining weight and having wet diapers, you're doing fine. Mastitis is an infection that needs immediate treatment. Don't ignore it. Oversupply can be managed with block feeding and positioning. And remember, fed is best. If you found this video helpful, hit that subscribe button. My next video is all about postpartum recovery and what nobody tells you about those first 6 weeks after birth. Drop a comment and let me know. Are you planning to breastfeed? Are you currently breastfeeding? And struggling? Let's support each other. You're doing an amazing job. Even on the hard days, you're doing an amazing job. I'll see you in the next one.